access to both therapeutics that are coming up and also vaccines. So we all have a role to play in terms of stretching our antibiotics, in terms of spreading the word, in terms of the doctors in the room making sure that you know what you're treating and treat it well, not just going blindly and prescribing antibiotics without really getting to know exactly what pathogen is giving. Thank you.
Okay, thank you so much, Doc. I believe that this will will provoke further reflection and discussion among the audience with such a thoughtful response. Thank you so much. Dr. KINUTHIA, many consider themselves to neither have the time nor the money to wait out the body's own immune system to heal a minor infection such as an ear infection or tonsillitis. What norms and values do we need to change in order to reduce further spread of resistance?
Thank you. I hope I don't have to leave this. You can hear me? Yes. Perfect. Thank you, Lucian, and thank you for having me here. I think AMR, we can talk about AMR the whole day, but I also like the way Dr. MARRIANE has really brought out the issues and summarized the issues for us. And as we are doctors and we are also patients out there, I think that's a very interesting question because we all treat ourselves, isn't it? Yeah? We've done some self-medication someday. Yeah, and we know deep in our hearts that this is a viral infection, but I think Dr. MARRIANE teaches us that at some point we might have superimposed bacterial infection. So we want to cover that before it happens. And I think that's one of the main challenges that we face as AMR and AMS champions. A lot of self-treatment, a lot of lack of knowledge in the community about antimicrobial resistance and what needs to be done. So the fact that you know you have a viral infection and you can wait it out, you need to have that knowledge and that discipline. I think as Kenyans, we also lack a bit of that discipline of that we can take care of what we have currently so that we can use it further. So your question was, what are the norms and values that we need to change? So I look at it from both sides, probably looking at it from us as healthcare workers. What do we need to change about this? One, we need to, ensure that we are aware about antimicrobial resistance, and we have very many channels to make sure that we are at par and up to date with what's happening in the field of AMR. I know it's been one of the challenges, even as we work with different partners on how to introduce AMS training, even in the pre-service level. By the time you get out of med school, you need to have gone through trainings on AMR. Doc also mentioned issues of using guidelines appropriately. Most of the times we have national guidelines, policies, protocols in place. We also have facility protocols in place, but how keen are we in implementing this? So we need to ensure that we are adhering to that. Another thing is, of course, use of our appropriate diagnostics. Many of us don't want to go the whole length of, you have a patient, you take the history, you realize there could be some infection, but we tend to just cover the infection, and we make sure we give the broad spectrum antibiotic that will cover anything, whether it's tonsillitis or UTI. It will cover wherever it is. So I think as medics, we need to also have that discipline of tracking our patient properly, doing the right labs at the right time before you start your antibiotics, and ensuring that we are implementing the right protocols. Then, of course, there's the issue of educating our patients. I think the patients we have these days are very enlightened. Of course, there is Dr. Gugu that they first talk to before they come to talk to you. But giving them the facts, and of course they ask a lot of questions, not like our older generation that doc has said this, that's what goes. So they ask a lot of questions. So are you educating them about, using the right antibiotics at the right time, right dosages, storing their medications well? Are we educating them about how to dispose remains? Issues around not to share antibiotics with other people with similar conditions and all that. Then there are issues of probably supply chain issues, where we have a lot of issues around antibiotics supply these days. We have issues of counterfeit, we have issues of substandard issues. We have issues around unavailability of antibiotics at the right time, at the right place to be able to manage these patients. So have we sorted our regulatory system in a way that we are able to ensure that we have the right products, quality products for these patients? So I think I can go on and on, but just a glimpse of what are some of the things we need to change.
Thank you so much, Dr. KINUTHIA. Before we go on, Doc, would you like to add anything about to talk on the topic? Would you like to add on the same, on what Dr. KINUTHIA has mentioned? Okay. Okay, that's fine.
Maybe I can add one more thing that I should have mentioned, being also an infection prevention and control practitioner, that it's very key as healthcare workers that we implement IPC measures in our, in our care of the patients. Because the more we prevent these resistant bugs from spreading from one patient to another, then we are trying to contain or helping in containing the AMR bugs.
Thank you so much, Doc. I think we've gotten very many points in that question, how we can actually change in order to reduce the spread of resistance. And I'd like to address my next question to Dr. MARRIANE. Why is there a need for a coordinated action using a One Health approach that you had actually mentioned earlier in tackling AMR?
Thank you very much. And something interesting before I tackle my question is what Dr. KINUTHIA has mentioned. What maybe was raised some bells in my mind was actually the question of, and someone asked me that in the team, how do we advise our patients? How do they dispose their drugs? Do they throw them in the garbage? Do we just throw them along the road? And when we do that, do you know the implications in the environment? Because again, we throw them in the soil, they're gonna come there and plant something, or animal is gonna come and eat something there, your chicken, and your chicken is gonna, at some point you're gonna eat this chicken, or have its products, and again, that whatever product that you threw away, again, comes back to you in a different cycle. So, are we just going around rotating ourselves in a cycle that we need to be able to pinpoint where the mistakes are happening and how can we prevent that? And this actually links to the question One Health. Okay, but I've left you the question, how do you dispose your medications? Do you throw them away? Do you know the standards, the guidelines of how you do that? I'm hoping that Dr. KINUTHIA may tell us more what are the guidelines, because before someone asked me that question, I am embarrassed to say I'm one of those people maybe who would look, oh, it's expired, and yeah, throw it in my garbage. Yeah, again, embarrassed to say that. Again, as I mentioned, One Health approach, and in the projects that we're doing, that's one of the key areas that we're concentrating on. So we're not just working in silos, and I've already explained to you one of the cycles where antibiotics may come back to you. You could be doing all these things, avoiding misusing those drugs, treating your colds with steam and taking vegetables and fruits, but at the end of the day, there's someone along your cycle who may not be taking these precautions. You may be eating very healthy, very nice vegetables, but where were they grown? How are they grown? What manure was used? What animals are around that area? And again, how are these animals being treated and being handled? Because again, the chain is very small. So and that's why we started projects known as the One Health projects that look at this problem, the AMR problem, as one. So One Health. And when you say One Health, we're looking at both human, animal, environment, and now I'm seeing also people from agriculture coming in to form that complete cycle of One Health. And we are privileged to be in the Fleming Fund, where you have funds that bring us together once in a while to compare notes in terms of how you vets controlling AMR, how you prescribing, how you treating your animals. And if you are a farmer in this house, you also know that sometimes we give supplements to our animals. So these supplements make them grow faster, avoid infections in the first place. One of my parents keeps chickens, many chickens. And I went just to see the products she gets from Kenchi, because they're given food for the animals. And right there on the package, antibiotics. Again, they're given antibiotics in the animal feed so that your animal grows faster, avoids infection, and again, it's a food chain. So within 6 weeks, they're coming for the chickens to go slaughter, and this chicken, the nice drumsticks will be on our table. But remember what I saw there? Antibiotics. So again, it comes back to you. You're doing all the best you can to avoid taking antibiotics in the first place, but it's in your food. So that's why having a coordinated approach, that telling the people manufacturing these foods, these fertilizers, can we avoid, prescribing these antibiotics? Are there vaccines that we can give our cows, our chickens, to prevent these infections in the first place? Again, we are doing our part, which Dr. Kinuthia has already alluded to, infection control, making sure our babies are being vaccinated, we're having follow-up to prevent these infections. But we need also the vets, the people in the environment also taking control, in that one day we'll be able to say we got ahead of antimicrobial resistance. We have antibiotics that are still working effectively, and again, I'll repeat my dream. We have vaccines that are preventing these infections in the first place, so we don't even have to think of antibiotics. So again, I hope you're seeing that chain of One Health and how we need to be so coordinated in tackling this problem of antimicrobial resistance in all these pockets of these multidisciplinary teams. Thank you.
Thank you so much, Doug. On that note, you brought up something interesting, that you can actually try as hard as you can to not overuse and misuse these antibiotics and still get resistant. Actually, the question is, could you still get resistant from eating the example we gave, chickens that are bred with antibiotics?
Yes, because again, you're introducing that antibiotic that's in maybe in the protein that the animal fed from back to you. So again, you've consumed that antibiotic, not directly, but indirectly, which again is same misuse. Yeah, but unknowing misuse, but that's, again, that's why being One Health coordinated and having a team that is looking into this should help us avoid that misuse of antibiotics. And that misuse is starting right from what are we consuming, what are the people around us consuming, what is coming onto our tables. Is it fueling this AMR by what is being given to supplement their growth or to make them bigger or fatter and more delicious?
Okay, thank you so much for that response, Dr. MARRIANE. I'd like to also still tackle One Health with Dr. Kinuthia. AMR straddles the human, animal, and agricultural sectors, as Doc has just mentioned. What are your thoughts on the realistic chances that you can bring the agricultural sector and the public health sector together as they belong to two ministries?
All right, thank you, MARRIANE, for that initial response. And just to add the aspect of eating antibiotics in